With HCA's commitment to opening up this rehab center, we're essentially investing in the community, saying this community deserves a rehab center that can focus on the intense rehab needs of its population. We take patients that have cardiac issues, stroke, traumatic brain injury, spinal cord injury, respiratory. There's also joint replacements, hip and knee replacements, as well as amputations, and general debility patients as well. We're one of the rare facilities that offers all three disciplines, and so we offer occupational therapy, physical therapy, and speech therapy services, along with nursing and physician care on a daily basis. By offering all three, along with 24/7 nursing care and physician care, we make sure that we have a whole picture for that patient so we can progress them as best we can. Our building is unique that it's separate from the hospital, and so patients that come here, they have private rooms. They're in this serene setting that's out in the middle of the country, and so they don't feel like they're in a hospital as much as possible, to be out of their beds, because that's what they do when they're at home. Our goal is to get patients back to doing what they were doing before they came into the hospital, and so part of that is making sure that they are engaged in activities outside of their room, not just therapy, but recreational activities. We have an outdoor garden, whether they like to read outside. We have a day room. Just participating in daily activities that are both active for them for what they would do in their prior lifestyle is what we want to get them back to. By being close to town, they can get the family support and the friend support that they need from the community. We find that that in and of itself lifts the patient's spirits up, to know that people can come in and visit, that people can actually stay if they want to, and be with the patients, be actively participating in their therapy. And then there's some accountability too, that their loved ones are there watching them to make sure that they're progressing well. So it's much more difficult when they have to travel 100 miles to the next rehab place. By being in town, all those resources for the family can be right then and there. Because we are a part of the hospital, our physicians are readily have access to their records through the electronic medical record. And even patients that come from the outside HCA facilities, their records can be accessed as well. We have communication with those physicians as we need it, and they're still part of our systems. There's no longer this disjointed communication because they're going to a facility that's outside the scope of the hospital. We are a very family-centered rehab center that we want patients to stay within their community and then go back into their community. And so we are here to stay, and we are here to serve the community, and they no longer have to go out of town to receive the A+ services that they've come to expect from other facilities. It is right there here in their own backyard.